everyone. Tops of the day, of course. For today, we'll be discussing about the concept of your Myasthenia Gravis. This is one of the important concepts and disorders under your neurology nursing or adult health nursing. Okay, so just after the Parkinson's, we will be proceeding with your myasthenia and we'll be continuing with your multiple sclerosis, Guillain-Barré syndrome, and so on and so forth. Okay, so let's start talking about this concept here. Class, kapag sinabi nating myasthenia gravis, the problem here compared to your Parkinson's disease is quite different. Okay, although when it comes um, to the most evident and the highlight assessments or the signs and symptoms, nagkakapareho sila kapatid. But when it comes to your MG or myasthenia gravis, it's quite different when it comes to cause. Okay? So, let's have first the description or the background of this disease. Okay. First, kapatid, we need to consider and we need to remember that this is an autoimmune disorder. Kapag sinabi nating autoimmune disorder, kapatid, yung katawan mismo natin yung gumagawa ng disorder na ito. Okay? So it means that it's not because you did something, it's not because yes, there's these predisposing factors, but when we say autoimmune disorder, basically, kapatid, it's our own body. That's why it's autoimmune. Okay, basically, it's the immune system. Okay? Or the substances that's within our body. Okay? That's creating something that's not in order. Okay? So, when we say myasthenia gravis, kapatid, it is an autoimmune disorder. Okay? It affects the immune system, again, because it is an autoimmune disorder. And what happens here is that the immune system, kapatid, creates an antibody. Gumagawa ang katawan natin, specifically the immune system. Okay, it creates an antibody which attacks the acetylcholine receptors that we have in our body. Okay, remember that your acetylcholine receptors or the acetylcholine is a neurotransmitter, kapatid, that's responsible for the involuntary movements, for the salivation, okay, basically for the normal functions of your muscles. Pero dahil dito nagkakaroon ng problema, okay? Dito what happens is that gumagawa ng antibody ang immune system natin at ina-attack yung acetylcholine receptors natin sa ating katawan. Okay, so basically magkakaroon ng disruption of the normal functioning, okay, of the neuromuscular system. Now, another concept that we need to remember is that this is more common among females aging 20 to 40 years old. Okay, now let's try to have this one compared to the previous discussion that we had on the Parkinson's. Kapatid, sa Parkinson's, ang problema is nagkaroon tayo ng mababang dopamine, okay, mababang dopamine production in the basal ganglia. Okay, it's an autoimmune disorder, okay. The most evident and the most common description that we can have with your Parkinson's is that it's a chronic and it's a degenerative and it's a progressive disorder. Unlike here, it's an autoimmune disorder wherein the body creates an antibody and attacks the acetylcholine receptors. And it's more common on males, among males, especially those who ages beyond 50 years old. Okay, in myasthenia gravis, kapatid, it's more common in females aging 20 to 40 years old. So that's a total difference, okay, from the two concepts. Now, another thing that you need to remember as well, kapatid, is that when we say myasthenia gravis, okay, it is also affecting the neuromuscular system natin. And along the way, we'll be talking about weakness, weakness, and weakness. And that's totally naman the same when it comes to your Parkinson's disease. But in your Parkinson's disease, okay, it's because of the stiffness, it's because of the rigidity, but here, it's basically weakness per se. Okay? So now, kapatid, what are those things that we'll be seeing in our patients with myasthenia gravis? Okay, first is your ptosis. Kapatid, kapag sinabi natin ptosis, this is now the dropping of the eyelid, okay? Or basically, this is what's happening to those patients, kapatid, na patulog. It's like ptosis, okay? The upper eyelid, the upper portion of the eyes, okay, na kung saan nagkakaroon tayo, hindi na natin control. That's what we call as your ptosis. Okay. So, nagkakaroon din ng diplopia. Kapatid, kapag sinabi natin diplopia, that's double visioning. Okay, and we all know that. Dysphagia, difficulty in swallowing, just like in your Parkinson's. Okay, and remember that kurtosis is always being asked in your NCLEX and PNLE. That's an NCLEX and PNLE favorite. Again, diplopia is a double vision, and of course, fatigue. Okay, dahil nga inaatake ang ating acetylcholine receptors. So basically, nagkakaroon tayo ng muscle weakness. So madaling napapagod. Okay? Easy fatigability, that's the right term there. Okay, nagkakaroon tayo ng easy fatigability dito sa atin pong myasthenia gravis. Another, you need to remember na nagkakaroon din si pasyente ng dyspnea. Bakit? Because of the overexhaustion, okay, because there's too much, okay, effort na kailangan gawin niya. It's because of the fatigability na meron si pasyente, kailangan niya mag-exert, okay, ng more and more and more oxygen. Okay, aside from that, remember that your respiratory system is also consists also your musculoskeletal, okay, frame. Okay, may frame po tayo sa ating pong rib cage. So, also, nagkakaroon din tayo ng weakness in the diaphragm as well in the muscular system or the muscles that assists in our breathing. Hence, nagkakaroon po tayo ng dyspnea. Okay, we need to remember that one, kapatid. Okay, so now you have dyspnea on your mind. So what you need to remember is that priority airway. Okay, you need to prioritize your airway. And remember, of course, one of the assessments na makikita natin is muscle weakness. Again, it's because of the attacks that being done on your acetylcholine receptors within your muscles. Okay, so let's continue doing this. What is the diagnosis? Well, there's a certain diagnosis that's being done, okay, on your myasthenia gravis, and that's what we call as your tensilon test. Why is it called tensilon? It's because of a certain drug that's being used as well on this test. So we call the drug edrophonium tensilon, which is an anticholinesterase. Okay, so the route of this one is intravenous. Again, it's a test wherein kapatid gumagamit dito ng isang drug, okay, which we call as edrophonium, okay, which is an anticholinesterase. Okay, interventions. Ano nga bang ginagawa natin sa pasyente, kapatid, na mayroong myasthenia gravis? So, okay, let's talk about this one here. So, first is we give our medications. What medications, kapatid, ang ginagamit natin? We give corticosteroids, okay, which decreases the antibody. Again, alam natin ang yung corticosteroids, kapatid, nagpapababa yan ng ating immune system. So, it decreases the antibody. So, example of a drug that's given sa classification ng corticosteroids is your prednisone. You write that down. Another medication, kapatid, is nagbibigay din tayo ng anticholinesterase. Ang function naman nito, kapatid, is that it increases the muscle strength. Okay? Again, it increases the muscle strength. So, sample of drug under your anticholinesterase classifications, that all of those drugs which ends in your stigmine, just like your neostigmine, your pheostigmine. Okay? So, remember these drugs. Okay, another another intervention that's also done in your myasthenia gravis is the plasmapheresis. So, kapatid, ang plasmapheresis naman, it's a procedure wherein the antibody is being removed from the blood. Okay, it's because nga gumagawa ang katawan natin, no, ang immune system natin ng certain antibody which attacks and gives a problem to our acetylcholine receptors. Okay, so we need to remember these nursing considerations. Firstly, the complications, kapatid, mayroong complications na dapat nating bantayan. First, is yung tinatawag nating myasthenic crisis. Okay, kapag na-under-medicate ang ating pasyente, pwedeng magkaroon ng myasthenic crisis. Because we may presume na nagtitake na ng medication sa pasyente, yun pala, hindi sapat, it's not the right dose, so we always give the right dose to our patient to avoid the myasthenic crisis. So what are the symptoms of myasthenic crisis? All of those that we have laid down earlier in your assessments. Muscle weakness, it will become more and more extraneous and more dreadful to our patient. Okay? Upon the other hand, If we over medicate our patient, cholinergic crisis will also happen. Okay? So, that's it for your Myasthenia Gravis, kapatid. I hope and I pray na may natutunan po tayo for today. Thank you, Tops, and have a good day.